in. We're ready for you to get tested.
Hey, how are you? Good to see you. I'm sorry, I'm not sure. I'm like,
Are they being tested? Is somebody there agreeing with them, or are they little kids? Do you trust the 10-year-old? All right, so, okay.
well, yeah.
We just don't want to expose them if they're not getting tested. Okay. Hi, is this Latanya? All right, we're ready for you to get tested. Come right on in there.
Okay. Me and my head bitch.
What's the reason?
It's not one thing. Sometimes it's multiple reasons. We still have people that are concerned about the safety. Still have people that feel like, you know, it probably won't happen to me. So you still dealing with that. And you're still just dealing with, they're getting a lot of people. For example,
Did they call you guys to come in?
one of the reasons we go to events like this is share materials and hear the service of resource. We want to make sure that folks get factual, current information. So that when they make a decision, it's based on informed.
Yeah, it's hard. Unfortunately, we're getting up to that wall where there's so much confusion.
Right, if I would have used that, I would have
Hear a lot of it. Well, I made it this far. Which is unfortunate. I think the Omicron wave is proving that wrong. You know, today 44,000 people positive today. So we are really skyrocketing. It's going to be this work. You know, people talking around the dinner table, and unfortunately, people knowing a family member who has been impacted. I'm so sad that it's taking us to that point of personal tragedy to get people to change their minds. So I think that's where we are.
How you doing today?
Good. Your work is making a difference, so thank you so very much. Is there anything we can do better to be helpful?
You know, one thing that I think we're focused is on, or has started to help already, is distribution program from the state and PPS for the PPS. That's where we got a lot of our people from. And folks are really appreciative of this.
They called you?
God to save my money, he's going to be on Sunday. He don't change. I give him credit for that. He don't change one eye. Except when he gets mad. And when he gets mad, I called him. Last week I told him, I said, man, you run and go there. Man. You keep walking around, you're going to whoop something. It is. You would think that. Sometimes I can't feel it.
You're handsome now. I ain't gonna lie. I said you handsome now. I ain't gonna lie. You got some. I know you got some girls on.
Well, terrific.
Did you get a chance?
I haven't yet. Sorry.
Well, this is Cassie. She's our program coordinator.
Hey, I see. Okay, so the C on the necklace is how I will remember.
Yeah. So,
Cody, it's nice to meet you.
Nice to meet you.
They were out in the community. That folks also didn't just have to go to their primary care or the health department, but could come to a recreation center like this or another park, and it's a comfortable environment where folks feel safe and protected. So that's what we worked really hard to get out into the community.
That's great. It's too bad the pool's not open.
Oh yeah. But we did see a lot when we had those different recreational programs going on.
For the county, city, I get it.
Not so fun.
So we try to make it a fun family event. The Bringing Back Summer campaign from the state was very awesome.
Thank you all for being out here.
You know what we hear a lot.
Much better than answering emails. Much more fun than my email.
I know they're doing this cool governor live, but I'll be happy to show you around just a second. Our operations.
Let me go say hi to a few of these folks real quick, and then we'll, yeah.
Spread it out.
I'm already sad.
Well, now to look at it a different way, the most money don't come from the
A lot of them don't think I'm about to.
How you doing?
How you doing? I'm good. Did I say my name? Oh, yeah. Oh, yeah.
See that white truck?
You're right. Oh, you look so
Such a great man.
Yeah. I mean, I swung that door open as hard as I could.
What's going on?
I was like,
Hey
there, how are you?
Yeah, that's the main man.
Mayor, how are you?
Good to see you. Good to see you, sir.
Good to see you, Mr.
All right.
Commissioner. Good.
Good to see you.
Thanks. Thank you all for letting me come see what you're doing today. Good things, I know.
We're always glad to have you in our midst.
Well, it's always a great place to be to get back to Eastern North Carolina.
Sure.
Yes, sir.
It's good.
Yes,
Is that Chris over there?
Chris. Yep.
Good to see you again.
Yeah, thank you for coming.
I feel like I've been a part of your growing up.
Right.
You know?
Yeah.
That's true.
What, did I come maybe 4 years ago, 5 years ago?
Right. You visited our office and stopped and talked with us. Now here for a vaccination event. Good to see you.
You were but a teen.
Right. And now I graduated college.
I know.
Here are the bow tie.
I see. I was going to say. Yeah. Good deal.
Yeah, we're glad to have you.
Well, I'm glad to look. Hey, good to see you, sir. Good to see you, sir. Thank you for your service. I appreciate you, sir. Yes, sir. Hi. Hey, how you doing? Good to see you. Nice to meet you. Thank you guys for the good work you're doing right now. Thank you. I appreciate it. Okay. Leela, how you doing? Good to see you. You okay? Yes, sir. All right. Hey, how you doing? Kody, how are you? Hey, folks. How are you? Are you guys part of the Kinston Teens? Yes. Well, good to see you all. Thank you. Thank you for your great work. For helping to coordinate this with the city. I know about him. I've known him for quite a while now. So that's great.
So Governor Crew, this is Chastity Pate. She's our programs coordinator with Kinston Teens. So
that's great.
She's really led a lot of our vaccination work over the last year and a half now, putting on events like this, and not just so, in familiar locations in our community. So recreation centers, parks, churches. This is our 14th event now.
That is fantastic. Thank you. Got to go where people are.
Where people are.
And meet people where they are.
Because particularly people who are hesitant or, may not be sure what's going on, trusted voices can make a real difference.
Yeah, and it's also made a difference having faith leaders here. Mayor Don Hardy, he shows up at all our vaccination events. So trusted faces come and remind people the importance of getting vaccinated or the importance of getting tested. So, and we've just built such a strong reputation and trust in the community too that a lot of folks trust us. If we say get vaccinated and we explain why, folks really see the benefits of it.
That's fantastic. Well, it's making sure that people know that they can prevent serious illness for themselves and their family members when they do this is so important.
Most definitely. Well, I'd love to show you inside.
Yes, I'd love to see it.
Meet for a few more folks and see our operation.
Absolutely. Hey, folks, how are you? Hey, how are you guys doing? Nice to see you. Thank you.
So this is
Secretary, where do you go? Come on.
Hey,
nice to see you.
All right, I'm Cheryl Bryan. I'm the Regional Director, Region 6 for Healthier Together, and we're here today to share resources and provide information and work with one of our collaborative and grant-funded organizations to make sure Eastern North Carolina can get the testing that they need and the vaccinations as well.
That's great. I appreciate you getting accurate, science-based information to people to convince them that this is the thing that they need to be doing right now for themselves and for their family and for anybody around them. So it's really important. Thank you for that.
Well, here in Kinston, we're very grateful for the state's investments in Healthier Together because it's still not just our nonprofits, but so many of our nonprofit partners across the Eastern North Carolina are benefiting from both funding from the state as well as this accurate information we can share with our community.
Well, this preventive effort and dealing with the whole person, that can make a real difference in saving money down the road, keeping people from getting seriously ill, not just with COVID, but other issues as well. And this Healthier Together effort, we are looking forward to that working eventually all across the state. If somebody continues to have to go back in and get treated for allergic reactions and asthma, and all it would take would be to replace a carpet in somebody's house, and it would reduce all those visits and all that treatment, then that's the kind of thing we ought to be doing. So we're gonna keep working here.
And I do want to meet, this is James, Mr. Powell.
How are you?
One-to-one with you.
Oh, wonderful.
Coordinator for the Community Health Work Project in Wayne County.
Thank you.
Yes, sir. Thank you so
for the
much.
work you were doing.
Absolutely.
It matters so much.
Thank you, sir.
Appreciate it. Being out there every day on the front line. It
Thank
means
you
a
for
lot.
coming.
Absolutely.
Thank you, Governor. Appreciate your support.
Thank you.
Absolutely.
Yeah, Chris gonna lead you.
Okay. Hello there. How are you? Nice to see you. How you doing? Nice to see you today. Hey guys, how are you? Nice to see you, Governor. How you doing? Good to see you. How are you? Good. Thanks.
Right.
Hey everybody.
Hey, how you doing?
Good to see you.
How you doing, sir?
I'm great.
We built a really great partnership with our Parks and Rec program here in Kinston. They hosted a lot of our events, so having that support, them letting us take over the gym from basketball for a few hours, it really means a lot for them to have that support from our local government.
I was just talking about coming up here. I used to play high school basketball at Northern Nash, and when we came to Kinston to play, things usually didn't turn out very well for us. So,
I got their training right here at Holloway a lot.
Well, the multi-purpose uses of this community center can be really important, bring people together for a lot of people. You can develop trust in one area that can help you in another area. And
So we can go to the gym,
Yeah.
the governor, then we can get tested, and we get a shot, right?
That's right.
Same spot.
Do it all.
That's right.
Do it
That's
all.
those the goals, Chris.
That's right. So we're going to allow you to meet some.
I'm good. Thank you. Thanks a lot. I appreciate it.
We're going to allow you to meet some of our vaccine and testing staff here.
Yeah. That's great. Hello. How are you guys?
Okay. We're actually going to
today.
How you doing?
Okay. We're going to meet some of our.
You met Governor Marcoux.
You gonna get the shot?
No.
Not today.
Say
You
no.
gotta get it though when you get after older than 5. You get it. Hey,
How you
thank you for your help with what you're doing here. Really appreciate it. Thank you.
this operation here, we have 5 folks from StarMed getting providing our testing and vaccinations. They have a very smooth operation here. So having those state vendors, the state is paying for the public community centers like here in Kinston, and they've been just so efficient in providing information, providing very timely results to folks.
Yep.
And then there's no wait at all for folks come to get vaccinated or get a booster shot. So they keep things going really smooth.
There we go.
Walk through here right.
How are you? Thank you both for the work you all are doing here. Well, it means a lot. What are people feeling? What are people telling you when they finally get vaccinated?
Well, they feel safer. They want to be vaccinated because a lot of people in their families they've been suffering with this virus. So they're happy. They want the booster.
That's wonderful. Still got work to do.
Yes.
So that's one of the reasons we are here, is trying to spread the good news here.
Yes, we have to, and I think we're doing a great job. At least we are working really hard to do it.
That's great. That is so great.
This here is
Thank you for coming. Are you with StarMed?
Yes, sir. I'm the territory coordinator.
Well, thank you for that coordination and the work here. Appreciate it.
Yes, sir.
Appreciate it very much.
Vaccinating here, we're testing here, so seems to be going pretty smooth.
Yes, yes, sir. I don't want to call much to it. How you doing? Good, man? Nice to see you. Glad you all are here. Thank you. Good. Good. Hey, glad you all are here. Thank you. You getting tested or vaccinated today? Tested. Good to see you all. Hope everything's okay. Sure. Can I get a picture with you? Yeah, sure. I like your shoes. Hey, thank you. They're more comfortable than ours right there. All right. More comfortable than ours. Thank you. Absolutely. What grade are you in now? All right. I like your fingernails too. Thank you so much for your work. Really appreciate it. Thank you.
Yep. Hey folks, these folks have been administered vaccines here.
Hey.
How are you? How are you?
I'm well, thank you. Thank you all for the work you're doing.
Thank you. Yes, sir.
How long is this particular vaccination?
We started right before Christmas, so I believe
Okay.
the second week in December, and it's been flowing pretty steady here.
Great.
And a lot of people are showing up, Governor, thanks to Chris, Kinston Teens and DHHS. I do appreciate that. That's really a big deal for us.
Well,
it's a great place to be, and it's centrally located in the place where it needs to be.
That's right. Strong voices. That's important.
Yes, sir.
So we've done a lot to really do some grassroots efforts to get people out here. We've been knocking on doors, we've used social media outreach, we've even done phone banking, so taking it old school to make sure folks know about this location and that folks know they're eligible for a booster shot.
Right.
With that timeline from the CDC barriers to 5 months, that's made a lot more people eligible, so that's helped out a lot.
That booster matters a lot.
Yes, sir.
I want some of your shoes.
Let me know what size you wear.
Thank you for your work.
Thank you.
I appreciate it. Hey.
Yes, sir.
How you doing?
Good, sir.
Yes, sir.
Yep.
Yes, sir.
Well, maybe hard to go through a little bit this way?
Yes, sir.
Oh, this is exciting. I always love it. Shot going in arms. I know that our healthcare professionals do.
Yes, sir. Get it. You got it. Go right ahead.
They are seeing the burden now. It's getting tight in our hospitals and in our ICUs. And, it's going to be a real gift to them.
Right. Right.
Okay. Governor, can they get a picture real quick?
That would be an honor.
Hi.
How about that?
Maybe you would have done something there.
Thank you all.
All right.
Thank you. Really appreciate it. Good work.
Doing well. Thank you.
All right, Jordan, you want to take it from?
Yeah. I mean, if you don't want to kind of.
Hi, folks. How are you? Nice to see you.
Okay, cool. So these are where folks who got their booster shot. They're spread out here.
Great. Wow, that's good. That's really good. Yeah.
Here again, using that public space as much as possible.
That's fantastic. How you doing? Good to see you. Hey guys, how are you doing today?
So this is Governor Ward Cooper. He came to visit our operations here in Kinston.
Yeah, good to see you guys.
How y'all doing?
Glad to hear. This is your mayor, and this is your city councilman, Suggs.
And this is
Marty.
your governor.
Yeah.
How about that? All in one shot.
All in one shot.
One day. One day.
Good to see you guys. Thank you.
So it's been a really great success to be able to get this location here, especially just considering how overwhelmed our hospitals and even our local social department is. And being able to, we actually have a new site opening next Tuesday at another recreation center that will be operating all throughout the week and out of God.
Okay. Well, that's really great for this, Mayor. Thank you all. I know this has been a joint operation.
Absolutely. We appreciate it. Appreciate everybody come together so make it happen.
Are we ready? We can enter everything. Hey guys, how's everybody?
All right. Doing okay?
A little bit more. That's good. Thank you.
All right. Yeah. Great. Yeah. Match protocol.
You can, whatever you order, what you typically do, take it out with the speed.
How are you doing?
Good. How are you, Governor? Thanks for coming and joining us today.
Glad to be here. Thank you. You ready to go once you get back?
Absolutely. Yep.
Great.
Good afternoon, everyone. My name is Chris Suggs. I'm a member of the City Council for here in Kinston, and I'm also the founder and CEO of Kinston Teens Incorporated, a nonprofit youth-led organization based here in Kinston, empowering young people through service, leadership, and civic engagement. We're extremely grateful for the opportunity to provide consistent vaccination and testing efforts here in partnership with the City of Kinston. As we all know, the COVID-19 pandemic has extremely impacted our communities, especially small communities like Kinston, already home to many health issues and health disparities. So to be able to provide these testing and vaccination opportunities, increasing vaccine equity, especially in marginalized communities, means a lot for us as an organization and as the City of Kinston. We've worked very diligently and in partnership with organizations like the City of Kinston and News Regional Library to provide consistent vaccine opportunities like we're providing here today. And we're extremely grateful for the great investments from the state of North Carolina in our efforts. Through North Carolina's Healthier Together program, a vaccine equity program, as well as the state's new personal protective equipment program, providing PPE for community organizations like Kinston Teens, we're able to distribute thousands of KN95 masks, N95 masks, and other highly effective pieces of PPE to our communities. So thank you all for joining us today. We're extremely grateful again for those state investments in our efforts. And today we're joined by Governor Ward Cooper and Secretary Kody Kinsley of the North Carolina Department of Health and Human Services. And we're extremely grateful for their presence here in Kinston, highlighting the importance of our work and also signaling the importance of vaccine equity in our communities. We look forward to continuing our partnership with the state to help get our communities vaccinated and navigate through this COVID-19 pandemic. Secretary Kinsley, I'll now turn it over to you for remarks.
Thank you so much. It's such a pleasure to be here in Lenoir County. Since the beginning of the pandemic, we've had over 11,000 cases of COVID-19 in Lenoir County, and in the last week alone, nearly 600. Unfortunately, the Omicron variant is incredibly contagious, but we're focused on doing three things. We want to save lives, we want to save hospital capacity for every emergency, and we want to keep our kids in the classroom. Seeing what we're seeing here today is exactly how we do that. Vaccinations, boosts as soon as you're eligible, and wearing a tight-fitting mask. I want to thank everybody here for doing their part to protect their local community, their friends, families, and their county hospital. It's my great pleasure and privilege to work for a leader who cares so deeply about North Carolina, who thinks of every single person in this room and in this state for every decision that he makes. Ladies and gentlemen, Governor Roy Cooper.
Well, thank you, Secretary Kinsley, and very grateful for your leadership. As of January 1, you became Secretary of the Department of Health and Human Services, and you and I know big shoes to fill, Dr. Kody Cohen, but you have worked with her for almost the entire tenure, and Dr. Cohen said herself, nobody is more ready to do this job than Kody Kinsley, and already he's making a big difference in making our state healthier and more prosperous. It's always great to be in Eastern North Carolina, where I grew up. I told Mayor Hardy and some other people that I played high school basketball at Northern Nash and Rocky Mountain when we came to Kinston, that it often did not go so well for us, because I know this is a hotbed of basketball, but it's also a place where there are wonderful people, and I'm always glad to come here. And when I am here, you get to see uplifting things like Kinston Teens, and grateful for all of them being here. And I met Councilman Suggs a number of years ago. I feel like I've almost watched him grow up. His strong leadership and leadership of other young people in Kinston and Lenoir County is going to make this an even better place for people to work, live, and play. And I'm so grateful to be here with my friend Mayor Hardy, whom I'm going to introduce in a minute, but I'm grateful for the commissioners and the members of the City Council who have been here and who have worked so hard during this pandemic and beyond. And I'll take a minute too to thank from the bottom of my heart the healthcare workers who have been on the front line, who are having to shoulder a lot of the burden. We have exceeded where we were before as a peak with people in the hospital with COVID. And one of the reasons that I am here and one of the reasons we are working so hard is we want to keep people who catch COVID from getting severely ill, from having to go to the ICU, and from dying. And it can be a real love letter to healthcare workers for people to get vaccinated and boosted, showing that you care. You do not want to be one to come and put extra burden on them, because the fact remains the vast majority of people who die from COVID, who go into the hospital and into the ICU, are people who are unvaccinated. And we know now from scientific evidence that boosters can make a real difference in people's severity of illness when they catch COVID, that it can protect you so much more. Right now we've got about 65 or 66% of the population of 65 and over who've gotten boosted. We've gotten more than 90% of them who've gotten vaccinated, but getting that booster is so important. And here in Lenoir County in the City of Kinston, I know people are working very hard to get shots in arms, to get people tested, and we wanted to come today to let people know that we want to provide the resources for you. We want to work to keep our kids in school, in the classroom, because it's so important for them to learn there, and getting the protection of the vaccine. We now, for children 5 and older, can get a vaccine. We encourage parents to make sure that your children are protected. But I'm now, before I come back up and take questions from the media, I'm going to introduce to you a friend of mine who has been a Navy veteran serving our country, serving the people as a police officer, and now the mayor of Kinston, Mayor Don Hardy. Mayor?
Well, thank you, Governor. Thank you for your leadership. Thank you for North Carolina Department of Health and Human Services. Congratulations to you, Secretary Kinsley. Thank you for the great work that you're doing and what you're going to continue to do. So thank you, our commissioners that came out today, Lenoir County. Do appreciate you for being here as well. Kinston Teens, and also Councilmember Chris Suggs. Thank you for your job, the job that you do continuously to make sure that we are put in a position to make sure that everyone in our city and county are able to receive a shot and or a test. What better place to have it than at Holloway Gym, where you can get your shot, you can get tested, get the booster shot, and you can play basketball. What better place to be than Holloway Center? So I just want to say thank you, each and every one of you, for coming together collaboratively to make sure that we are able to get shots in arms, make sure people get tested, and make sure we're moving in the forward direction and not one step back. So thank you for your time, and always remember this, that life's most persistent and urgent question, what are we doing to help others? And I look around this room, and I think all of us are doing our part. That's my time. I'll yield back to Governor Cooper.
And that Reverend Dr. Martin Luther King quote is as relevant today as it has ever been. So thank you, Mayor. And I'll now open for questions from the media. Also have Secretary Kinsley here as well. Questions? Yes. So, number one, supporting our public schools and making them better and making sure our children have a strong public education is one of the most important functions of state government. And we need to make sure we recruit the best educators and teachers. Right now, however, because of COVID, there's significant staffing problems, and they're having difficulty finding enough people even to be substitute teachers. So we want to provide state employees with the incentive to go and volunteer as substitute teachers and for other jobs that are needed in the school, whether it's bus drivers or people to help with traffic, because we know that they need it right now. And the incentive is that as long as your supervisor approves and everybody can get the work done, you can use your paid leave to go, and then you can keep whatever money that you would earn. You would have to have a course to help you know what you need to know about being a substitute teacher. But we think now is a time for all of us to pull together. Our state employees have always stepped up to help, and so we believed that this was a good idea to try to help our schools out at a time that they desperately need it.
When that policy extended until the 15th, are there plans to extend that if we need to, or what's the reasoning behind it right now?
Well, we know that we're in a very severe staff shortage situation. We are hoping that this Omicron variant will follow what has happened in some other states and countries, and that we see a significant drop over the next few weeks and month. And so we've set the deadline to February 15th. If we see we need to extend it, if it is working well, then obviously we could. But now we've got about a month that we want to have state employees to encourage them to help out our schools at a time when they really need it.
Hey, Governor, Kody Kinsley with WNCT-TV News Channel 12. Thanks for joining us today. Earlier today, the President did brief the nation saying about 15 million tests are being performed across the country. You know, you break that down per state, that's only about 300,000 tests, which, of course, on a population of about 10.5 million is only about 3%. Right now, what is your administration's plan to continue to up that number, especially as we near that February deadline where people who are unvaccinated will have to be getting tested much more regularly?
Number one, we want people to get boosted and vaccinated. But number two, testing is important, particularly for people who feel that they have symptoms of COVID. It's important to know that we're testing more people than ever. I think maybe yesterday was a record in the number of tests that we have provided for people. We've set up more community centers and provided more help, but I'm going to let Secretary Kinsley deal with the specifics of what we're doing to try to get more tests out there.
Thank you, Governor. We are incredibly committed to getting as many tests into North Carolina as possible. To date, we've spent nearly $200 million getting tests into North Carolina. We are looking under every rock, going to every vendor, nationally, internationally. As we know, this is a very competitive international market where folks are grabbing these tests. We're grabbing them just as quick as we can to get them here. Incredibly thankful to the federal government, the support they will send. We have been able to open up hundreds of community testing sites and vaccination sites. And so we would encourage folks to plan ahead as much as they can, and we will continue working. I suspect testing will continue to open up as we get into February. We know right now it's taking folks to plan ahead and to do everything they can to get tested.
Well, I'm going to get one here. Yes.
As the governor, what does it mean to see groups like Kinston Teens in communities like this hosting events? And do you think that this increases receptiveness of people who get vaccinated and tested? And do you think the state needs more action on this?
So we've done a lot of research on people who have yet to be vaccinated. You know, we've got about 74% of the adult population that's had at least one shot, and we've got a number of people who are unsure. We've got maybe 15% so far are hard no, but the persuadables often are listen to people that they trust. And I talked to Chris, and you may want to address it, Chris, but I've talked to him about trusted people in the community, talking about others who have gotten severely ill or maybe even died, and how important it is to get that vaccine. And some people who are unsure can be persuaded by Chris's voice or one of these other teens' voice even more than mine, because people are trusted in the community. And that's why I'm so glad that Kinston Teens is here to do this. Chris, would you want to say something to that?
Thank you, Governor Cooper. Yes, Kinston Teens, as I shared earlier, this is our 14th vaccination event that we've hosted as an organization. And our events have been well attended consistently throughout the pandemic, and we've made sure to host those events in fun and familiar locations like Holloway Recreation Center here, at Southeast Elementary School in Kinston, as well as churches and other parks. So to have a trusted and familiar location, as well as trusted and familiar faces like myself, members of our organization who are from the ages of 12 to 22 years old. So our classmates and friends from high school or folks we play with are coming and hanging out with us and getting vaccinated for COVID-19. So those trusted and familiar faces from the community, as well as having our local elected officials like Mayor Hardy, members of the City Council and County Commissioners, have also been very involved in this fight to get folks vaccinated. Again, we've also partnered with faith-based organizations here in Kinston and churches, and Kinston Teens is a part of the state's Healthier Together initiative, which is a public-private partnership between the North Carolina Department of Health and Human Services and NC Counts Coalition. So with Kinston Teens being a part of that coalition, we're one of many nonprofit organizations that are working to build vaccine equity by using trusted voices, as well as safe and accurate information, and ensuring that information is distributed to our communities.
Pandemic beard's looking pretty good, Chris. I hadn't seen it. Yes. So keeping children safely in the classroom is one of the most important things that we have to do. We know that there was a lot of lost learning. We know that a lot of children were suffering with mental health issues. I'm pleased that the schools and DHHS and everybody worked real hard to help them during that time, but we got to take steps to make sure that they are there. But when they're there, we're working on science that shows us how to best protect them. And I'll let Kody talk just a minute about what's happening in our schools now and how that's making a difference.
As Governor Cooper said, keeping kids in the classroom is a top priority for us. And what we know is that when local schools adhere to our Strong Schools Toolkit, that the transmission rates in the classroom are incredibly low. And in those situations, kids are able to stay in the classroom. We are constantly updating that guidance. You know, exclusion from school is an absolute last resort. There's so many ways kids can stay in the classroom, being vaccinated, mask on mass exposures, and even now with reduced quarantine and isolation periods if you are exposed. But the thing I would add to that is that every community member can do their part to keep kids in the classroom as well by doing three things: getting vaccinated, getting boosted as soon as you're eligible, and wearing a tight-fitting mask. That's not only helping keep kids in school, but that's protecting our healthcare heroes that are working so hard to keep us safe.
Thank you, guys. Appreciate it.
Let's get one outside.
Y'all can do that. Good.
How you doing, sir?
Good.
Good to see you.
Nice to see
Glad
you.
to have you here. Yes, sir.
I'm glad to be here. Thank you, sir. Thank you very much.
Doing great. We're picture over here with our city staff members.
Yeah, sure.
Miss Rhonda.
Hi, folks. How are y'all doing? Nice to see you. Hey.
We can do it right here since you're on the side over here.
Sure, let's get a little bit better backdrop.
Hey, Governor.
Yes, sir. Yes, sir. Come on outside.
Getting warm in here. That's quickly. Yeah.
Hey, how you doing?
Okay. Let's get a picture of all the city folks over here in our Parks and Rec staff.
All right. What do you want to do? Where's your camera?
Let's see. Let's get the Holloway in the background.
All right.
Yeah.
Come right over here.
Now we're talking.
There you go.
All right.
Okay.
That's all right.
Yes, sir.
More of us on the other side? All right.
I do.
Yeah.
Yeah,
and Chase.
Here we go. All right. Ready? 1, 2, 3. 1, 2, 3. There you go. Right. Smile with your eyes. Smile with your eyes.
Yes,
Thank you.
Let's take one by our tent, Governor.
Okay, let's do that. I know I had a couple other people who wanted to picture. I'll do that before we leave. You're good?
All right, yes, sir. Let's stand in front of the tent and
All right.
get a picture with some folks.
Okay.
All right, y'all want to come around front or?
Thank you so much.
No problem.
All right.
Do you want to come on this?
Okay.
Ready? 1, 2, 3.
Somebody got your phone?
No.
Okay.
All right.
Thank you.
Proud of you guys.
Yeah.
Thank you very much.
Thank you so much for coming.
Deeply, deeply appreciate it. You want a picture? Yes, sir. Yeah, please. Yeah. Do you have a Mayor can get it to you, I guess. Is that yours, Mayor?
Yes, sir.
Okay. Great.
Thank you, John.
Yes, sir. All the best. Okay. Thank you. Thank you very much.
No problem.
All right, we're going to get one more picture.
Okay. All right. Hey. Great.
Thank you.
Okay, thank you all. I appreciate it. All right, Mayor, keep it up, bud.
Yes, sir, Governor.
Nice to see
you later.
Yes.
Yes, ma'am.
Not at all. Not at all. Yes.
Mr. Powell, can I ask
Hold on one second. Let me get
Thank you, sir.
Oh, yeah? How you doing?
Got it?
Okay.
Yes, the mayor, I have an honor to meet you today.
Man,
You'll be everywhere.
good to see you. Okay, good to see you.
Got it? Okay, ready?
Sorry, medical fair. Working the front line.
That's right.
That's right.
Thank you.
Yep, great.
Mayor, can we get a photo with you,
Yes,
sir?
ma'am. Yes, ma'am.
Because you're the mayor.
Thanks a lot, Chris. Yes, sir. Yes, sir. Thanks for all you've done.
Yes, sir.
Appreciate it. All right, thank you guys. See you later. All right, thanks, guys.
Thank you.
Have a good one.
All right,
Jordan.
we're gonna send it.
Okay. Do you have the email address that you need?
Only one I need to see.
Jordan right here will give you the tell you what
Information.
Okay. Can I give you, how are you? Can I give you my card? Sure can. It has my cell phone number on it. Okay. So you'll just give me a call.
I sure will. Thank you, Eric.
And I won't be back to Raleigh till later today. So if I don't answer, just leave me.
I'll wait tomorrow.
got an email with the details on it.
Okay, cool.
Thank you.
Thank you.
Yeah, she did. If you got problems, then you can call Mayor.
I got a business card.
Okay.